Next up, we have Dr. David Brennan. David's an associate professor at OHTN and an OHTN chair in gay and bisexual men's health. He's the director of the Cruise Lab, and he's in the Faculty of Social Work at University of Toronto. He's a leading international scholar whose research focuses on the health needs of gay and bisexual men, and particularly those who have been marginalized by a number of sociocultural factors, including age, gender identity, race, and HIV status. Professor Brennan's more recent work includes examining how gay men use online spaces and apps for social and sexual connections, as well as for health education and service access. He's examined the impact of racism on body image among gay men of color and the roles of resilience in indigenizing health research among Aboriginal Two-Spirit men living long-term with HIV. He's also examined the impact of several factors on HIV risk for gay and bisexual men, including the role of history of childhood sexual abuse, optimistic beliefs about HIV and optimistic beliefs about HIV treatment. He's examined psychosocial issues related to aging for those living with HIV. And finally, he's examined the ways in which we measure sexual orientation in population-based health studies, as well as the resiliencies, strengths, and assets that gay and bisexual men have that prevent them from becoming infected with HIV. He's published numerous peer-reviewed articles in high-impact journals in his area of interest and research expertise. So welcome, David.
Hi, everybody. I need a little water. How we doing? We're good? Okay, great. Thank you. Thanks for that. So I'm going to report on some of our findings from the Cruise and Count study. This was an Ontario provincial-wide study of gay and bisexual men and their access to apps and health information online. I want to acknowledge my co-authors, Maya Kessler, Nathan Lachowski, and Rusty Sulemenov. So basically, we know that condom use, seropositioning are part of safer sexual behavior strategies, and of course, the gay and bisexual guys are using the internet for a whole host of reasons, not just to connect with each other, but of course to look up sexual health information. And so this particular study, what we wanted to look at is condom use specifically and seropositioning among HIV status discordant partners. And we wanted to understand the socio and sexual behaviors and factors associated with condomless anal sex without seropositioning among HIV status serodiscordant partners. Make sense? Good, okay. There's two parts to this study. One part is interviewing service providers about their role in providing health information through online outreach. And the other was an anonymous online questionnaire, of which 1,830 guys across Ontario filled out over the course of December 2013 to January 2014. And as you can see, we recruited mostly through apps because we wanted to connect with guys who were actively engaging online. In order to be in the study, you had to be 16 years or older, live or work in Ontario, or have visited it at least 2 times in the past year, and sought sexual partners or sexual health information in the past 6 months, or at least report an interest in doing so. And identifying as gay, bisexual, two-spirit, straight, queer, questioning, cis, or transgender men, in other words, pretty much anyone, and could report having had sex with another man in the last 6 months, or at least an interest in doing so. And the idea behind that was that we wanted to capture the experience of people who maybe were not necessarily sexually active. So we conducted combination prevention and multivariable logistic regression model to look at, for people who had reported having anal sex in the last 6 months, our questions were focused on their last anal sex event. So that's a limitation right there in terms of we're just talking about the last time. And what we did was we looked at how many people reported condom use, what % reported condom use, seropositioning, and then engaging in both condom use and seropositioning. So these questions were asked in December and January 2013-14. There was very, very little information at that time about PrEP. And I also want to acknowledge that there was also very little, there was some information about U equals U and the possibility of seropositioning, but whether or not it was, how much it was used or how much it was associated with people's knowledge about that, I think is kind of hard to interpret. So you'll see what I mean as I go through. HIV risk was defined as HIV-positive or negative participants engaging in condomless anal sex without seropositioning with an HIV status discordant partner. And HIV risk was the outcome. So you can see from this graph, essentially we just wanted to break down what the race and ethnicity. The average age of the negative participants was 34 and 45 for positive participants. In terms of, we broke down by HIV status, people's racial or ethnic identities, and you can see the breakdown there. So the vast majority for both categories were white guys. There were a larger group of folks who identified as South or Southeast East Asian. And in terms of sexual orientation, the vast majority of the guys identified themselves as gay, but a larger percentage of guys who were negative identified themselves as bisexual. And you can see the range of education there as well. In terms of the past anal sex in the past 6 months, the bright blue bar is none, and the darker blue is one partner, and the green is more than one partner. So you can see that positive guys reported having more than one partner, a little bit higher than those guys who identified as negative. And if people had anal sex, we wanted to know, did they meet their partner online or not? And so you can see, essentially, it's pretty close, but negative guys were more likely to report that they did. So it's interesting how this is coming out on the slides, but okay. So 1,613 guys reported either an HIV-negative or HIV-positive status. So people who were identified as unsure were not calculated in this particular analysis. So 80% reported that they had had anal sex in the last 6 months, and among those who reported their most recent sex event with someone whose HIV status was known to be different than them, you'll see that about 64% of guys used condoms, and about 41% of guys used seropositioning. And then there were another quarter of guys who reported using both. So about almost 19% had reported neither of those practices. These are our fancy little charts. You'll see the numbers start to get a little bit small. But basically what we wanted to do is look at the type of concordance, so age status versus positive status with partners. So the first one is negative participants with HIV-positive partners, and whether or not they use condoms, you can see how the numbers go down. Around 50% of condom use of those not using condoms, 50% are not seropositioning, and yeah, that's basically what you want to see from there, that the number goes down as we move forward. For HIV-negative partners, participants with HIV status unknown partners, so it's not the participant, it's they didn't know the status of their partner. You could see that about 30% are reporting not using condoms, and a little over half of those report not seropositioning as well. For folks who had an undetectable HIV-positive participant, so we did ask participants their viral load and whether their viral load was detectable or undetectable. We do not know the viral load of the partner. So again, at the time, this was a little bit before we caught on to the fact that we should be asking that information if we could. And what you'll see here is almost half of the guys report not using condoms, and just under half of those not using condoms are also not seropositioning. It is important to note that, as you identified as well around syphilis, that about 70% of the participants in this particular sample reported using drugs or alcohol as part of their last sexual activity. And finally, detectable HIV-positive participants with non-HIV-positive partners, very small numbers. So there's not a lot you can do with that in terms of inferential statistics. But just to descriptively, you'll see that about 2/3 are not using condoms, and about 3/4 of those not using condoms are also seropositioning. Of those not using condoms or seropositioning, alcohol use was, again, around 70%. So remember, we also don't know the PrEP status of guys at this time. The numbers were very small of people on PrEP at that time, if they had figured out a way to access it back then. So I think it's important to note that. So looking at our multivariable model was any reported HIV risk, and what you essentially just to remind you that it meant a positive or negative participant engaging in condomless anal sex without seropositioning with a partner whose HIV status was different from theirs. So about 5% engaged in HIV risk, so it's a relatively small number of the whole sample. And there's a slight increase as you get older that you might report you might report HIV risk. Alcohol and drug use, if there was one or if both partners were drinking or using drugs, a 2 or 3 times rate of possibly being of reporting HIV risk. And for those folks who had reported being tested for STIs in the last 12 months, twice as likely to report, 2.5 times as likely to report HIV risk. So things that were not significant were ethnicity, education, sexual orientation identity, geography across the province, and whether or not they met their sexual partner online. So as with any and every bit of research, including this, there's cross-sectional data, so we don't have really, we do have event-level data, but because it's cross-sectional, we can't really make any causal assumptions. So we don't know if seropositioning was actively chosen due to non-condom use. We don't know. We just know that it happened. Again, as I mentioned, the PrEP status of negative participants and partners is unknown, and the viral load of HIV-positive partners. We know it of the participants, but not of their partners. HIV-positive participants with undetectable viral loads included in the HIV risk analysis considered to have engaged in HIV risk if they had condomless anal sex. Data from the, it's important to note that this data is before the U=U campaign. However, I think it might be that some of these participants might be very aware from previous statements like the Swiss statement or other kinds of documentation that having an undetectable viral load would decrease their risk of HIV transmissions. And so it's actually quite possible that people were using that as a risk reduction strategy without us really knowing that, because we couldn't really take account of that in the analysis. So about 25% of guys who had anal sex with someone whose HIV status was different from them in the past 6 months engaged in some form of combination prevention, condom use and seropositioning. And about 5% of guys who had anal sex in the last 6 months engaged in some sort of what was being classified by this study anyway as potentially risky behavior. And the factors that were really kind of important were being older, HIV positive, using alcohol or drugs before or during sex, and having had STI testing in the last 12 months. All were associated with an increased risk. So I think the fact that only 5% of the men reporting what we would consider risk, and again, we don't know if that number could be overstated. These may be men for whom PrEP would be useful, maybe older in those using alcohol and drugs before or during sex. And of course, there might be very specific messages and needs for positive guys. So even though this was before PrEP, I still think the findings might inform us as to potential issues for non-PrEP users. So with that, I want to thank my fabulous team and colleagues. Yeah, I can stop there and we can take questions later. Yeah? Okay. All right. Thanks.